Wish TV's Focus on Food is a commitment to improving food accessibility in the community. Hear from expert culinary contributors, health professionals, and people who are making a difference in the fight to eradicate hunger. Made possible by Indiana University Health.
Research estimates more than 20% of adults in the country are living with chronic pain. It is more common in our country than diabetes, depression, and high blood pressure. Aiming to alleviate the effects of chronic pain, IU Health is dedicated to supporting patients. With more on exactly how diet does indeed impact life with chronic pain, ambulatory support, clinical dietitian for IU Health, Darien Harris, joins me today for this conversation. Really important. Thank you so much for being here.
Absolutely. Thanks so much for having me, and thanks for the emphasis on food.
Absolutely. So we'll just have a short conversation here. What defines chronic pain, and does it come with other conditions?
Yeah, absolutely. So chronic pain is persistent pain that extends over a period of time, typically years, and it can originate from many different things, from previous injury, illness, surgeries, trauma, and inflammation. And it's not system specific, so it can affect the skeletal, muscular, visceral, and nervous systems, and it rarely ever occurs within a vacuum. So it can occur alongside other comorbid conditions like mast cell activation syndrome, Ehlers-Danlos, dysautonomia, fibromyalgia, and oftentimes eating disorders, all of which have their own nutrition implications.
So how can someone in your position help someone living with chronic pain? Are there certain dietary needs? What were we talking about?
Yeah, absolutely. So dietitians within a clinical setting provide what's called medical nutrition therapy, which is evidence-based, individualized nutrition counseling to help alleviate certain medical conditions. Chronic pain and its common comorbid conditions being some of those specific medical conditions that, alongside a multidisciplinary team, dietitians can help to alleviate.
So what kind of nutrition plans specifically are we talking about?
Yeah, absolutely. Within a chronic pain population, the two most common nutrition care plans are an anti-inflammatory diet with a focus on balance and routine in order to ensure enough energy and nutrients to support chronic pain, but then also intuitive eating, which is made up of a 10-pillar framework that focuses on mindfulness and increasing one's intuition and awareness of self around their eating experience and relationship with food.
So this is obviously a really important topic because I think a lot of people might be dealing with chronic pain and obviously not know it. They do go eventually get that help. There are success stories I'm sure you have. Can you share any of those with us?
Absolutely, absolutely. So within the pain rehabilitation program at Methodist Hospital, I can think of a specific patient that I have helped. They came to me with chronic gastrointestinal chronic pain alongside gastroparesis and IBS-D, and they were absolutely terrified to eat for fear of pain. They, as a result, lost a lot of weight and muscle mass and energy and avoided social situations. Within a couple weeks of nutrition counseling and nutrition intervention, this patient is now able to eat and tolerate a wide variety of foods from all 5 food groups without chronic pain. They're starting to put back on weight, muscle mass,
Excellent.
Increase their energy, and they're also starting to attend social situations that they otherwise would have avoided.
Excellent. So we have a few more seconds here, but I do want to perhaps get some more information out to everybody watching. That's one success story. Mm-hmm. How often do people come in and treatment is successful?
Oftentimes. So our pain rehabilitation program at Methodist has a rolling patients come in on kind of a rolling time. So we have new patients every 3 weeks, and they go through an intensive outpatient program. And we have success stories within that 3 weeks, and then we also follow them in what's called aftercare. So their success might come after that too as we continue to help.
Excellent. Really good information. Really appreciate your time here, everybody. That's Darien Harris, ambulatory support clinical dietitian for IU Health. Again, thank you so much for your time.
Absolutely. Thanks for having me.
This is the Wish TV Focus on Food podcast, made possible by Indiana University Health. Find more on the Focus on Food website by visiting wishtv.com/food and watch the ongoing coverage on Wish TV.